You've talked about colon cancer. There's another area that most people really don't even think of, the liver.
Absolutely.
I don't think there are so many people who know exactly what your specialty is. Can you clearly explain that to us? You know, even the word is so difficult to pronounce. Not many people will be able to get it right.
If you have hepatitis C, you will go through a certain phase known as developing scarring to your liver, or what we call liver cirrhosis, before you can develop cancer. But for hepatitis B, you don't need the scarring phase.
Yeah.
It can just
Jump into
liver cancer, which is why every immigrant who has should be screened for hepatitis B. And if you're negative, you should get vaccinated to prevent you from developing hepatitis B.
Dr. G. Real stories, real people, unpacking the struggles, reclaiming the narratives with Dr. G.
This conversation is not a medical advice, it's not a prescription. This is a conversation for educational purposes. You've talked about colon cancer. There's another area that most people really don't even think of, the liver.
Absolutely.
Hepatitis B, hepatitis C, alcohol-related liver issues, herbal remedies, What should families understand about liver issues?
As I said from the outset, the liver is one of the key organs attached to the digestive system that we take care of. And it is, I typically call it one of the engines of the body. And if your liver is not working, you are in bad shape. And just like many other conditions, liver diseases are often asymptomatic or have no symptoms. You cited a few: hepatitis B, hepatitis C, fatty liver disease, alcohol liver disease. There are autoimmune liver diseases, cystic liver diseases. These are common conditions that typically also are silent. Of course, when they occur acutely, you may have some symptoms. And some of our folks never even go to see a physician, and that acute phase goes by until when things start going wrong or it's too late. Specifically for the liver, as opposed to like the colon, where we talk about colon cancer screening, one of the main things that I would tell immigrant populations is that hepatitis B screening is very critical. Unfortunately, hepatitis B is not a big problem in the United States, but it is a big problem in developing countries. Yeah. For example, those of you and I, we are from Cameroon. It's an endemic zone for hepatitis B. Yeah. And there are many ways by which hepatitis B can be transmitted, but the most common in our settings is mother to child. So your mother has hepatitis B, gets pregnant, and normally during birth they can transmit hepatitis B to their child. Yeah. And typically they may not even be diagnosed, but I must say now in Cameroon, I think one of the recommendations during antenatal clinics or prenatal clinics is screen for hepatitis B. Yeah. But I don't know if that happens in the smaller communities where most deliveries take place. Yeah. Because if we screen the pregnant woman, we have a protocol in place that we can put once they get to their third trimester, meaning 28 to 30 weeks of pregnancy. We will test their blood, determine how high their virus count is, and we will do things that should almost at 95% stop the baby from becoming infected. But so it's often a silent disease. Most people with hepatitis B will never have any liver-related complication, which is the reason why we don't treat everyone with hepatitis B. Yeah. But we have to monitor you. Because even though you have no symptoms from hepatitis B, the unique thing with hepatitis B is that you can develop liver cancer even though you have no symptoms. Wow. This is as opposed to something like hepatitis C, where if you have hepatitis C, you will go through a certain phase known as developing scarring to your liver, or what we call liver cirrhosis, before you can develop cancer. But for hepatitis B, you don't need the scarring phase. Yeah. It can just jump into liver cancer, which is why every immigrant who has should be screened for hepatitis B. And if you're negative, you should get vaccinated to prevent you from developing hepatitis B. If you are positive, there are criteria we use to determine if you need to be treated. The reason why we don't treat everyone is because there is no cure. There is no cure. And if you get started on treatment, you will be treated for almost for the rest of your life. Very few people are able to come off treatment. So given that most people will never have any problem, we don't treat. But for immigrants from endemic zones, they start screening at the age of 20. Wow. Meaning every 6 months, once you turn 20 years, you need to get an ultrasound and not all, a blood test to screen for liver cancer. And if we diagnose it early, just like for colon cancer, we will have so much we can do to cure you, to get rid of the cancer. But if you come late, when the lesion is too big or it has gone to other organs, spread to other organs, it will be too late. So liver disease is acquired, but for immigrants, I would specifically want them to get screened for hepatitis B. The US, those who are in the United States, there's typically a recommendation that everybody gets a one-time hepatitis C screening test. But that's a test, that's a virus. Hepatitis C is a virus, just like hepatitis B, which typically is acquired primarily today in the United States through injection drug use. In the early 90s, it was a big deal with blood transfusions, where hepatitis B can also be transmitted. But that's in the United States taken care of. But back in our populations where they just ask you to go get somebody from the street and breathe, blood transfusion remains a major thing. Thankfully, tattoos are not as common back home, but we do know of traditional healers who scarify people with blades from one person to the next without changing the blades, who can also transmit hepatitis C. So blood exchanges in any way will be your major risk factor. And hepatitis B primarily transmitted mother to child, but also through sexual contact. So get screened. Make sure you're very you're not a promiscuous person, so to say, because those are the main ways. But it's also important to talk about alcohol, which increasingly a lot of people are engaging in. That alcohol, apart from causing the acute problems to the liver, acute alcoholic hepatitis, it can also lead to long-term scarring and causing what we call cirrhosis, which again puts you at risk of liver cancer. And previously, alcohol used to be the number 2 reason in the United States why people got a new liver. And it ruins your life. So very important to pay attention to. And lastly, about the liver, I cannot complete this discussion without talking about the use of herbal supplements. A lot of, given that we come from a country with limited resources, folks have turned to herbs a lot of times to help with a fever, help with diarrhea. And nobody knows the content of those herbs. And because the liver is responsible for processing most of what we take in, it goes through the liver. That's why I call it the engine. Unfortunately, a lot of these herbs contain things that can impact the functioning of the liver. They can cause liver failure. Just like taking simple Tylenol in large quantities of up to about 7-8 grams can cause your liver to fail and you're done. Those herbal supplements can cause what we call drug-induced liver injury from herbs. So our people have to be careful. When you're drinking all of this stuff from that nobody knows where you got it from, that you can completely damage your liver. And of course, most common symptoms of liver disease, most are non-specific. Most don't have any symptoms, but people begin to, when the engine of the car is not going, the car begins to feel tired, can't run, and just get tired. But you can note yellowing of the eyes, abdominal distension, swelling in your feet, urine becoming a yellow or deep color. Those are typically signs of liver disease, and most can suggest liver failure. And there are a lot of others. People can develop veins in their throat that bleed. Again, we won't go to all this. I hope in the subsequent editions, when we focus on primary diseases, we can look more into that.
I just wanted to talk about this issue of primary care. I've been to hospital and I just felt like, okay, I'm going to the hospital to do full body check, and I get to the hospital and I'm asked, who is your primary physician? Who is your, do you have a family physician, a primary physician? And doctor, I don't. I don't. It looks like in the US here, you must have somebody that everybody in the family needs to be seeing, or you need to be seeing. Is it a must? Can I pick any doctor that I know that, you will be my primary physician, and must I have to go to you and everything? I don't know. Just explain that system for me.
Yeah, so your primary care physician is your first point of contact with the medical system.
Okay.
These are the people that know you best, that should know you best. We've been talking about conditions that can develop without you being aware of, meaning you have no symptoms. Every person needs to establish care with the primary care physician, irrespective of whether you have symptoms or not. For example, if you were 45 and had no primary care doctor, how will you know that you need to go for colon cancer screening? It's your primary care physician that will recommend that, hey, you're now 45. There are several things, depending on your age, that preventive care caters for. Females, when do they start breast cancer screening? By the age of 40.
Okay.
People that have weakened bones, screening for osteoporosis, screening for hepatitis B, screening for hepatitis C, screening for sexually transmissible diseases. These are all things that are done at specific ages, meaning you don't have to have any symptom. So you must, I will say, every person needs to have a primary care doctor. One of the other things is, every year you're supposed to have
full body
health maintenance visit with your primary care physician. He will talk to you, ask questions, screen for things like depression, check for some symptoms that you may be ignoring, not thinking that this is anything, and recommend the age-appropriate testing that you need, that you may not necessarily be aware of. For example, even blood pressure screening, diabetes screening, checking your blood count. We talked about anemia. Sometimes it's just doing a blood test and we see it. You don't have any symptom. You're like, hey, some people have had tests, go home, and in 30 minutes they are being called by their doctor, like, hey, go to the emergency. Your hemoglobin is 3. And you go, you get a call. Recently, about 2 months ago, I had a very young patient of about 21, and who had some anemia, and I couldn't think that this would be anything, but as I stuck my scope in, boom, there's a huge tumor looking at me in the colon. So everybody needs to have a primary care doctor. He's the one that gets your family history, digs into everything, knows you the best, and will make the appropriate age-recommended testing and screening so that we can be sure that despite you not having symptoms, you are okay. Me, for example, I already did my primary care visit this year. I am a physician, but I have my primary care doctor. And I just saw him in February. And I would say every person needs to do the same thing.
No excuse. No excuse.
Dr. G. Real stories, real people. Unpacking the struggles, reclaiming the narratives with Dr. G.